Forum for Autism is a parent support group to support families of children with autism. It was set up in the year 2002 under the Indian Trust Act 1950. Forum for Autism mainly aims at creating awareness about autism, empowering parents to advocate for rights of persons with autism. Forum for Autism is a parent body which runs two libraries in Kolaba and in Vashi with around 500 books. It also conducts parent training workshops, seminars, and talks. It has a database of parents and professionals and provides sponsorship to unaffording families. Forum for Autism participates in various activities. To name a few are Mumbai Marathon, conducted workshops for parents with young adults, celebration of World Disability Day at Malad Basti, and self-help skill workshop. Since the lockdown, Forum for Autism is continuing its work online. It has been conducting webinars on various topics like preparing to choose the boards, homeschooling, storytelling sessions, setting up residential setup, to name a few. All the parents who are interested can check those webinars on YouTube. Chef Sanjeev Kapoor and commentator Harsha Bhogle are the cause ambassadors for Forum for Autism. Throughout the lockdown, FFA, that is Forum for Autism, along with ASK, that is Adult Support Kendra, is offering online individual counseling, family counseling, parent support, apart from various other services. To know more about these services, please contact Nicole Kapadia and Suhasini Sundareshan on the numbers mentioned. Join our journey. Be an active part of Forum for Autism. To know more, please call on the phone numbers on your screens. Thank you for your overwhelming response to our webinars. Forum for Autism requests you to donate generously so it helps in our future endeavors. All the donations are eligible for the tax exemption. Please follow us on social media for updates on workshops organized by Forum for Autism. Please follow our Facebook page, Forum for Autism. Subscribe to our YouTube channel and check out our website www.forumforautism.org.
A warm welcome to each and every one of you who've enrolled for today's workshop. The topic for today's webinar is the one that highlights the starting of the journey of each parent and child with autism. Red flags in autism and what next after that. If we closely observe babies and young children around us, we'll see how naturally they experience the world around them and connect with people around them. They have an innate map to be able to reciprocate with the environment. However, this doesn't happen as naturally with our children on the autism spectrum. And hence, it's really important to know what are the areas that are affected when one is diagnosed with autism. And also, very importantly, which areas do we have to focus on and work on once our child shows the red flags for autism. So without taking much of your time, let's welcome two of our very experienced panelists. The very first person that all of us go to once we see the red flags. That's a developmental pediatrician. So we have amongst us a very experienced developmental pediatrician, Dr. Rajeshwari Ganesh. She's a developmental pediatrician with more than 2 decades of experience in assessing children and their unique needs. She assists many families in understanding the child's unique strengths and also their challenges. She's especially keen in training and helping parents and teachers understand the nuances of autism and attention span and different learning issues. Her work also includes screening preterm and offering early intervention services. Dr. Rajeshwari is also a certified parent trainer for the Project Impact Training Program for parents of children with communication deficits. She currently practices in Dadar, Santa Cruz, and Malad. Our second guest speaker for today is Dr. Anjali Joshi. Dr. Anjali Joshi is an expert advisor for Forum for Autism. She's a consulting pediatric occupational therapist and a recipient of the Spandan Award by Ministry of Justice and Social Empowerment in the field of disability. She's a visiting consultant at the SRCC Center for Child Development and Rehabilitation. She's also a master trainer for professionals groups and visiting consultant for national and international non-profit organizations working for children with developmental disabilities. So let's begin with Dr. Rajeshwari Ganesh. Dr. Rajeshwari,
Yeah.
We welcome you all and thank you so much for sparing time for all the parents today. So
thank you so much for inviting me for this webinar, and which I really think is a wonderful idea. Many times, we have a lot of labels and, labels for therapy, labels for diagnosis, labels for everything. But I think the need of the hour is to go beyond these labels and see what needs to be done in the time that we have. So with that, I think I start my talk. I'm sharing my screen. Please let me know if.
Yeah.
Is it visible?
Yes, it's visible. Yeah.
Great. So the topic is red flags, autism, what next? So this is the question that comes across every parent's mind. Naturally so, because autism, even if we say that your child is having some indicators of autism or autism signs are emerging or established, whatever it be, it's very vague for many parents because there are too many opinions and too many things that can go against. And there is no blood test, there are no x-rays, there's nothing that can help us make this medical diagnosis currently, except for a clinical impression, right? So therefore the confusion. So our aim here, my aim here is to share what are the things that we see when we do assessments, which makes us concerned about the possibility of autism. And hopefully, at the end of the talk, it should become clear to all of us, which are the areas, therefore, that we need to focus on in therapy and look beyond the labels. So what are red flags, basically? So basically, red flags are just indicators. They're just indicators which pinpoint that your child's milestones are not progressing in the way that it should. And these red flags or indicators are age dependent. So for a particular age, you must have these milestones in place, and 3 months from that age, it's fine. But if 6 months plus that age, you don't get. So for 18 months plus 6, you don't have those milestones. That means the milestones have got deviated. So that is the basic definition of red flags. So the red flags for autism, now this is a lot of medical jargon, right? So social communication, social interaction, and repetitive behaviors. There's a lot of underpinnings here, a lot of meanings here. So I want to break this medical jargon and share what is it that we're actually looking at when we interact with children. So at 18 months, what are the things that we are looking at is pointing. So pointing is something that is very important. And there's a lot of confusion about this pointing too. So usually when we ask parents questions about pointing, parents will answer that, yes, he points to pictures, or he will take his finger and put it on the book, or he will pull my hand and lead me to the object. That is not pointing. That is a different way of communication, because pointing has not yet come in. So pointing means where the child is standing, he isolates his index finger and he's able to point. And if the parent doesn't understand, he's able to use his eyes to indicate to the parent that he wants this. So we call this the dance of eyes along with pointing. So that is a very, very important milestone, which starts kicking in by 12 months. And so therefore, by 18 months, if pointing is not there, simple pointing to indicate what the child wants or what the child needs, even if that is not there, it is definitely a red flag. The second thing is pointing to body parts in pictures, because it's not about knowing body parts in pictures. It indicates that the child is responding or listening to what you're saying and wants to respond, has the capacity to respond to your questions and your queries, and therefore responds to that. So this we call as reciprocal, as in you've asked a question and the child has responded back. And the same goes for responding to name. So only if you respond to your name will you understand that somebody is talking to you. And I have read some very disturbing articles on Google saying that responding to name call is not an indicator. But I want to share this with you. When we are assessing the preterms at 8 and 9 months, we are able to pick that they are not responding to name call as much. And when we have taken steps at that young age to correct it, taught parents strategies, how to make them respond to name call, they have started doing that. On the other hand, parents whom we pointed this out to and unfortunately were lost to follow up, because they moved to another place or the pandemic related isolation happened. When they have come back for a follow-up assessment at 2.5, 3 years, we see that very, very, very well defined. So this pointing, although I'm seeing it emerge at 8 and 9 months, by 18 months, if the child is not pointing or not responding to name call, it should be a warning bell in parents' minds that the child is having some trouble or some difficulty in engaging with the person next to him. And therefore, the child may not really initiate or look and make sure that you are looking at the object that they are pointing to, because that is what will give them the object. So if they're not able to do that, they are generally their cognitive skills will help them find other solutions. So what will they do? They will pull your hand or they will give you the object. And if they are not able to get the object, they will go near the object and they may use alternative forms of communication. So they may scream, they may shout, they may cry, they may bang their head. So all these things are alternate forms of communication, just because pointing has not happened. And they are not able to imitate the caregiver's actions. And sometimes we also see in history that there are some children who have lost these skills. They have begun pointing at 12 months and 13 months or 8 and 9 months, and sometimes they have lost these skills. Although in my practice, when I see this, it just makes up about 2 to 3% of actual regression because of a neurological problem. Like I shared with you, many times we see, when I see videos, I ask for videos of children, at 8 months, 9 months, 10 months, and 11 months. And luckily parents are very happy to share that with me in the consulting sessions. And we can see that, even at that age, the pointing was not very well defined, or responding to name also was very well defined. But even then, loss of any skills at any age. So if the child has started doing that and you can see a gradual loss, it must raise a warning bell. And the last that I have put, the last point is meaningful words. So for us as clinicians who make this diagnosis, or for interventional professionals who work with the child, there is a hierarchy of communication that comes in. It's always from easy to difficult. So it's very easy to imitate simple actions like pointing, or simple actions like simple motor actions, and verbal imitation is the most complex, right? So therefore the words with meaning is important, but along with that, we also have to check for whether these non-verbal methods of effective communication are in place or not. And by 2 years of age, when we see the red flags, we also see that there are repetitive behaviors. The play has not developed because the imitation skills and the responding skills have not progressed as quickly. And therefore the child has no other option but to, play repetitively with what he has. And if you try and take that away, he or she will naturally get upset, because there's what else can the child do. So the whole perspective here is, looking beyond this, okay, repetitive behaviors is autism, lack of communication is autism. It's not that. There is a difficulty here. There's a challenge for our children to do these particular skills. And so these are the skills that we must be very, very aware of. So eye contact, not responding to name call, delays in speech, so not using around 50 words with meaning by 2 years of age. And therefore, logically, if the child is not able to engage, the preference is to play alone and have repetitive play. So by the age of 2.5, all the symptoms of autism usually kickstart. So now I want to share with you a video about twins and this mom interacting and engaging with them. One is in this, one is showing early signs, one is not. So what I have spoken about, I hope will be clear after this video. Is the video playing? You can just do a thumbs
Yes,
up.
it is.
Okay.
Question.
Oh, it fell off. That's right. Here it is. Uh-oh. No.
This is the other twin, Nathan.
Boy. Ready, set. You can push. Oh, stay there. Stay there. Go. Stop. No. Nathan. Here it is. Good train. Stay up here, please.
So here we can see that Benjamin, the first child, is very engaged with the mom. When she says push, he's trying to copy her. He's trying to copy her actions. At one point, she says, oh, look, it dropped. And then, he shares with her that enjoyment of the interaction. Now, Nathan is also able to push. So there's no problem with the pushing action, but he's not really looking at mom and telling her, look, I'm listening to you. I'm listening to what you've got to tell me. When you are saying, look, I know I need to look. So both children, they are twins, they are boys, and one has all things in place. So eye contact, responding to name call, and other in simple instructions, simple imitation, right? And also the words, correct? And Nathan, on the other hand, is struggling. And the mom also, I think, is struggling to get the child engaged. And this, I think we all need to remember that it can be so, so tough to, sometimes we all say, do this, do that, do this. But I think it's tough. It's tough. We cannot ignore the fact that it is very tough. So I'm going to play a side-by-side video of both of them.
Boy. Ready, set. Push. Go. You can push it.
Right? So these are the things that I have made a note of, which I've already told you, which Benjamin was doing, and what Nathan was struggling to do. It was not that he didn't want to play. Many times we make the assumption that the children don't want to play. It was not that. It was just that perhaps he found it overwhelming because he could not do it. And this is the second video of responding to name. And you can also see the body language of the child in this video.
You want to try to see if you can get him to respond to it?
No. Evan. Evan. Evan.
See maybe if you can get him to respond to you now, you can use touch with his name, like give him a little tickle or something.
Evan. Evan. Evan.
He likes the tickles, but he's just not giving you too much eye contact, but he does smile when you tickle him.
Evan. Evan. Evan.
How hard it is for this mom to just get him to, he likes the tickling, he's smiling, he loves his mother's touch, but he's just not able to share it with her in a way that we understand. He's doing it in his own way. He's smiling, he's making that, that funny face, but he's not doing it the way we are used to, looking and pointing and asking her to do it again, which makes it really tough. Now, I want to show you what is typical play, because this is what I mentioned.
Make some ice cream, stir. Stir it up. Ooh, it's delicious. So good. That's good. I'm gonna get some more. I want some chocolate. Ooh, delicious. It's chocolate. Lots of chocolate. Put some in too. Want some more chocolate? Here's your ice cream cone. Delicious.
Now, I want to bring to your attention that this child, you couldn't hear any words. I mean, she was just jargoning some words. But what you could see was her sitting face to face with the person playing with her, looking at the person. When the person asked her a question, she used a non-verbal mode of communication. She imitated the person's actions, and she even did a beautiful pretend play of eating the pretend ice cream from the person's lap. So this brings home the point that I'm trying to make, that words are important. Of course, language delays is important. There's a lot of confusion with language because sometimes our children are echoing. They are using 1, 2, 3 ABC from screen or the videos that they watched. But the question here that we need to ask is, are they using it to communicate? So if our child wants to play with 1, 2, 3, is the child coming to you and saying 1, 2, 3, give? So that becomes meaningful communication. If the child is standing in one corner and singing 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, he is communicating. He is using those words, but he's not able to share it effectively with you. And that's the difference, right? Now, I want to show you immediately what is, a play that is not very organized and ordered. So
That one doesn't have anything in it. Let's go. It's for you, Evan. It's for you. Hello. Hello? Oh, you want to talk to Evan? Here you go.
So here you can see that the child is unable to share. He's interested in the toy, not that he's not, but the way he's sitting, the way he's looking at the object, he's actually even looking at what she's doing but he's not able to copy that action, and he's not engaging or giving eye contact or responding when the name is called, or when the person is trying to teach him something. So these are clear-cut differences, wherein these core areas that we are looking for when we are doing assessments for children. And, it is evident in 2 minutes, 3 minutes, or 5 minutes of us doing the assessment that these are the patterns, because all these videos were, only so many minutes clips, right? Now, many parents ask me if the child is a late bloomer or a late talker. So I want to share this video. Is that what it is? Now in this video, this girl is late. She's not
toy is
walking.
that over there? That bear? Is that bear yours? Is that yours? Can I see it? Or is that a cow? What is that? Wow. Is that yours? Let's see. Show it to the camera. The camera says, I want to see that bear. No. Can I see the bear? Says the camera. Please.
See, this girl is not really responding, but look at the way she's engaging with her parents. She's shy, you know, she doesn't want to obviously engage with the third person, but she's able to attend to her mother pointing to the toy across the room, her father telling, show the toy, and she's looking at him and she's like, kind of, okay, should I do it? She's also following the instruction of the person who's giving it to her. So in the beginning, the person said, get that teddy bear and show it to the camera. So she got the teddy bear and then suddenly she felt, oh, okay. So this is, you know, this shyness that we think our children are shy and they don't open up with strangers. But this is what I want want all of us to understand, that even if the child chooses not to talk or not to respond, with the caregivers, the child will engage. And even with the person who's trying to talk to them, they will look at the person, they will give them sustained eye contact. They may non-verbally follow simple instructions, but they may not be very open to talking. So this difference is also very, very important for us to understand. Now, the $1,000,000 question, is it really autism or is it pandemic related? Because we didn't have enough opportunities to stimulate children. They had a lot of screen. Or, you know, is my child like Einstein or somebody who spoke late? Is it just that? Are we really panicking? Should we panic? See, for now, whether this was pandemic related surge of autism is difficult to tell. Because pandemic has caused COVID in many mothers and children, and there are studies which are checking to see if these children are headed towards the ASD spectrum, and so far we've not got any proof of that. Screen time, yes, has increased. Many parents were helpless because they had to use screen as a babysitter because there was really nobody else to take care of their children and they had to work. So a screen, yes, was used as a babysitter. But I always wonder, and I would like all of us to wonder, that was the child 16 to 18 hours on screen, and the child could copy all of those, and did we never really give our children a bath? Did we never really talk to them? Did we never really point things to them? Did we never really play with them? And if we did all of that, even if it was for a 15-minute or a half an hour, if our children's brains were wired, they should have picked up these naturalistic communication and naturalistic play from us. Even if we could give them around half an hour or 1 hour of, a play or whatever, talking to them. So this, I'm raising this point because there's a lot of guilt, there's a lot of blame that's happening around. And I don't think, we need to surround ourselves with this unless it is proven, unless medical science proves. There was an article in JAMA which says that screen increase screen, but here they only took questionnaires from parents. When we make a diagnosis of autism and other communication delays, we are always taking a blend of both. We are listening to parents, and we are trying to get on to our hands and knees and actually assess children and see if they are actually engaging with us and doing all of those things that you saw in the videos. So, so I think until medical science really gives us enough evidence or more, I think this debate is of no use to us, because it only intensifies our guilt and it creates more negativity in us, and that makes us or prevents us from doing what is really, really important now. And why and what should we do? I want all of us to look at this chart, and this chart is very important. You can see that the numbers, that's the one in black. See, these are the early years, 5 years, and this is 0 means when the child is born. So they are having their brain is responding to numbers, but it's not dipping down, right? It's just plateauing. And the peer social skills here, Okay, it's increasing by 3 and then it's kind of here. But look at the language. Look at the language. It's increasing at 2 years and then it's dipping down. It's dipping down here. And look at the regulation and emotional control. This is what it is. Look at where it has hit at 5 years. So dear parents and everybody, all of us who work with this, with children, it's very important for us to understand that there are sensitive periods in early brain development. And in this debate of whether our child is really Einstein, or, did we cause this, or is it screen, or is it that, or my cousin's brother's son spoke late and he's fine now. We don't know. We have no clue. We have not gone to that family. We have not sat with those children in schools. We have no evidence. We have no clue about what are the challenges that that child is facing. And in all this debating, we are losing critical time, wherein we can actually make our children better. Okay, we still think that screen has caused this, and it's not. But what do we lose in making use of this critical period of brain development and helping our child develop 2 important skills, that is language and regulation, both which are important for children to manage in the world around them and manage to the best of their abilities. If we don't try, we'll never know. And unfortunately, I see that in many families, because of this ongoing debate and well-meaning people giving this advice, I'm not, we never judgmental, well-meaning people, because they don't want their relatives and their children to be anxious, they don't want them to go through that. But unfortunately, this science is not known to many people. And it's very important that we understand this science. And there is a Center of Developing Brain, which is run by Harvard University. It is an online website. I would urge all parents and all of us to go through that website. It's very beautiful. It tells us a lot about the early critical. They're sensitive. It's not that if you don't work after this, the child will not respond. It's not that. But if you work in this age group, you're going to see very, very good positive changes. So this, I think, is very important for us. And millions of neurons are connecting in our brain every single day. If we don't, if there's obviously some disordered connection happening, if we don't make use of the time and we don't work, it's going to be difficult for us to make use of this time later. What goes wrong in whatever, autism or whatever we want to call it? What goes wrong? There are many theories. There's one mirror neuron theory, which says that we as human beings are naturally able to copy. Now, we see in our children, they're able to copy 1, 2, 3, ABC, but they're not able to copy actions of rhymes, pointing, how we are making eye contact. So maybe there is a disordered mirror neuron theory. There's still work going on in that. The second theory is disordered connectivity. So there's over connectivity or over focus or over precision in some skills and under precision or under connectivity in some skills. And that is why sometimes we see these savant skills, there's some things that they're exceptionally good at. Like I've had children come into my examination room and, I've never seen, I have a fire engine, which is a red color fire engine. And, children will actually point out and tell me the loop to put water is missing. Where is it? They'll keep pointing or they'll keep getting me the object. And then I'm able to understand what they're trying to tell me. More verbal children are able to actually use echoing and convey this across to me. And because we understand what they're trying to convey. And I'm amazed at how they can pay attention to such things and not get things like listen to when we are talking and respond to when we are talking. So this theory makes sense sometimes, that they do have over connectivity in some areas. And that's the reason why we also measure the head circumference to see what's happening. And we do think, science does believe that this is genetic in etiology. Environmental influences are still under research. We don't have evidence. And, so therefore, vaccines causing autism, like I shared in the earlier in this, that I'm seeing this disordered name call as early as 8 months, wherein the MMR vaccine is given only at 9 months plus. So vaccines, even from my observations, I can tell you that it's not. And there is a huge study done in Netherlands. They have excellent data. They have proven with this study that vaccines do not cause autism, and the other environmental influences yet not robustly proven. So I think now, so therefore, now when we know that, what is it that, what are the red flags, what are the things that clinicians are looking at and saying that, oh, look, these things need to come in. So eye contact, name call, regulating, paying attention to what the other person is telling you, being able to regulate yourself and copy, imitate, and some way or the other, show the other person in the way they understand that, you are engaged with them, right? So we call this initiating joint attention. So these are the skills that need to come. So the choice of therapy will always vary and will always depend on what are the child's unique strengths and weaknesses or challenges. We cannot generalize and say, oh, he's got difficulty in this, go to OT or go to ABA or do speech. It doesn't work that way. Every child needs a baseline evaluation, evaluation at 3 months, 6 months. There's a reason behind this. There's a science behind this, because we want to understand how this is progressing. If after 6 months of me giving a diagnosis and the child is still not pointing, I'm very worried. If the child has not developed a alternative good form of communication, is still banging head and crying and shouting, I'm worried, because I know that something is not progressing the way it should. So every evaluation, it is important to understand, dear parents and all of us who work, it is not sensory, it is not ABA, it is not ABLES. What are we working on? Are we working on eye contact? Are we working on, oh, look, she's swinging the child. Is she working on teaching him how to pay attention to her, regulate what she's saying, and 1, 2, and then if the child responds back 3, oh, okay, fine, he's regulated, he's listening, he's imitating, he's communicating. So these are the skills that I feel are more important for us to know. And so we must ask our therapy professionals and people, and even developmental pediatricians, okay, tell me, doctor, what is this that you are telling me is going wrong, so that I can talk to the people who are training me and understand better. Why is that important? Because it's important to learn, and it is important to do this at home. Now, the previous slide that I showed you, it also is mentioned that the intervention or the stimulation needs to happen repetitively in a predictable manner, and it has to be consistent. If that has to be the case, now we have a lot of research saying that we should stimulate children at least for 28 to 30 hours a week. There is no therapy center in this world that can give so much of therapy program. So it naturally depends on us as parents to learn what is happening, observe what is happening, and emulate what is happening at home. And many times these are simple things that we can do at home. We don't have to get overwhelmed and say, oh, we don't have the setup, we don't have this, we don't have that. There are many simple activities that we can do which will facilitate imitation and play. But what is important is the science. We have to understand what we are doing. In that video, the push video, what was the mom trying to work on? She was trying to work on imitation. She was trying to work on getting the child to regulate with her, sit with her. So once we know that these are the things, it will drive us. We will know that we have to push forward. We have to be consistent with and repetitive. Otherwise, what will happen if we don't know? We'll do it for 2 days and then we'll get disheartened. We'll feel very bad. And then the WhatsApp videos are always there. Many people are sending videos of how good their child is, what all their. So these are very detrimental, as it is, we are struggling. And then all these videos will make us more disheartened. So please, we really need to understand every child can make progress. We must not lose faith in our children. But if we don't understand what we have to work on, it's going to be difficult for us. Right? And therefore, periodic evaluations. Are we on the right path? Are the core skills coming? Is my child able to regulate, imitate, and communicate? These are the things that we need to look beyond, autism and communication delays and, all the labels that exist. So what are these evidence-based therapies? Now, it is beyond the scope, I think, of this lecture for me to get into this, but there are these websites that you can look at. They are collecting data from many children. So they see 10,000 children who've received gluten-free diet, 10,000 children who've received play and imitation therapy through occupational therapy or speech, or, direct teaching approach like through ABA. So they're looking at all these children, and they are very clearly saying that only educational interventions, teaching interventions are working. None of the other interventions are working, and they're all quick fix solutions. Now, if I have to give my board exams, I'm not going to be able to do it drinking camel milk or stem cell, even if I do have challenges. If I learn to do this in a different way, if my brain is trained to do this in a different way, I will be able to. That is the rule of the brain. None of these quick fixes are proven to work. There is research. Of course, people are searching. Nobody wants to deny the best possible treatment. But till date, we are not getting any proven evidence for these kind of therapies. So the moral is do no harm. This is one website. This is the other website. You can see there are free online modules. There are resources. This is a very good website. And you can download it. It's very helpful, and you can learn about the things that you need to do at home, because everything cannot happen in therapy. Like I said, sometimes parents need to step up and learn themselves, but learn from trusted resources. Don't learn from resources that are not trusted and are not having the endorsement. Or if in doubt, please talk to your pediatrician, your developmental pediatrician, or your neurologist, whomever you consult. They are trained people, or your therapists, whomever you consult. Please have a word with them. Parent support groups, everybody works on evidence-based information. Do reach out to the people who are ready to help you. And I have already spoken about complementary therapies. It's so tempting to do this. It's so tempting to get into this because it's easy, right? It's so tough to engage and do this repetitively, and it's so disheartening sometimes. But doesn't work. It's not yet proven to work. So we must not do anything that can harm our babies and cause health issues in them. So importance of play and imitation, I can't stress this enough. Even if you give me 5 hours, I'll be talking about it. Children who have struggled with imitation and play, there is a disordered mechanism happening. And this mechanism is disordered, and that is the reason why they struggle. And this mechanism somehow is, not in many children is okay for screen-based stuff like numbers and rhymes, which therefore causes confusion. But here, play and imitation, what I'm speaking about is with people, with social connections with people. So there is an area in the brain that is looking into this, and those connections are disordered. So we must ensure that whatever therapy programs we are attending focus on play, modeling, imitation. Imitation is the key step for communication. So this is very, very, very important. And we must ask the people who are working with our children, what is the skill that they are working on? Right? What is
Doctor, sorry to interrupt you, because you're raising such an important point. Many times the parents whose kids are newly diagnosed often get confused because their children have speech.
Right.
Because they are listening to cartoons, they're picking up language from there. So if you could just a little bit, help the parents with the difference between speech and communication here.
Yes. So like I mentioned earlier, is the speech associated with eye contact? Is that speech used for communication? So for example, the child knows the wheels on the bus go round and so the child will say round. But is that child, supposing he wants you to play that video, wheels on the bus go round and round, does he come to you? Does he say, wheels on the bus, wheels on the bus? He makes like he gives you eye contact, or she gives you eye contact. She ensures that you are understanding what she's saying. The same wheels on the bus is used as a communication prompt. Why? Because there's eye contact happening. There are all these gestures happening. Some way or the other, the child is trying to communicate. Now, a child who is echoing will say wheels on the bus, but many times will get the remote to you, or will pull your hand towards the TV screen, or will stand in the corner and sing wheels on the bus. Now, these also are mechanisms of communication, but they are not to and fro communication. They are not looking at you. They are not ensuring that you understand. They are just singing there and parroting. And if you don't understand it, Then the next step is they will cry or they will bang their head, but they'll not come to you and they'll make an action or look at you and, like that, use some non-verbal cues. And this is the difference between this echoing speech, the parrot speech, wherein they learn a lot of words. So definitely there are some pathways in their brain which are working, and the pathways in the brain which are responsible to use these words and use them for effective communication. And also they know these nursery rhymes and numbers, but the school teachers many times will tell you that, when we sing these things, they are sitting in one corner, and so that's very confusing for us. We say no, but they know the rhymes, they know the numbers, why they are not participating? Because for participation, you have to understand that, oh, that person is asking me to sing and I have to respond. I have to respond using these words that I know. So that these are the cues that tell us that this is simple echoing, wherein, there are some parts of the brain which are overworking and picking up language input from the environment, but it is only language, it is speech, it is not communication. Communication is what? You have to tell the other person in any which way. Supposing we go to a foreign country and we don't know the language, what do? We can rote learn language cues and tell the person, but beyond that, if we are not able to make them understand, don't we use non-verbal? Don't we point to things? Don't we shake our head? Yes, no. So this is very important. The non-verbal aspect, when a person doesn't understand, is important. And responding, if the person asks you, what do you want? You can't tell him something else. And if he doesn't understand, if he makes an expression that he doesn't understand, you will immediately go back to non-verbal. So in our minds, we are cued in to somehow make our point across in the way the other person understands. Shouting, banging, head banging, screaming, or not responding when the other person asks a question, or singing the rhyme 1 hour after the person has asked a question, clearly indicates that while the speech is there, it is not used for reciprocal communication. All right. So as parents, what must we do? So it's very important that we must understand the power of eye contact, responding, regulating, right? Even the way the child sits, the way the child is engaged with the person is very important. So we must educate ourselves about what are the core challenges. I think there's a lot of checklists and there's a lot of stuff happening in the internet, but those things are more overwhelming and confusing. You have to observe, and you have to ask the people who are assessing your children or are working with your children. Okay, tell me, this is eye contact. Okay, he's saying 1, 2, 3, ABC, but what is it that is communication, and what is it that is differentiating that from this echoing? Why do you say that my child is echoing? If you ask, everybody will guide you. And use trusted websites. Please do not use websites that are, if in doubt, please do ask the professionals who are in touch with you. And intervention options are many, but remember that it is always tailored to a child's needs. It is not generalized. And so we must know what issues our child has as an individual and plan our interventions accordingly. So the need of the hour now, there's a lot of research being done on developmental approach. We've already been doing it. So the direct approach is ABA. There are 2 forms of therapy programs that are endorsed. Okay, one is direct and one is developmental. There's nothing good or bad, or there's nothing hero or villain about any of this. It's always about perspective taking. It needs to be understood which child needs what is the developmental behavioral assessment, what skills are missing, what needs to be worked on, and then plan what kind of, just because your friend is doing ABA or your friend is doing OT and this didn't work and that, your children are not robots. They can't like click and just go on from one therapy to another because we want quick progress. We must clearly understand what is it that we are being taught in therapy programs, and then make decisions. And we have to train ourselves as parents. There are some wonderful parent training programs. Many professionals are training parents. So please make use of the opportunity and train yourselves in working on these core areas, because it's not easy to work on these at home. The therapists are trained, they are professionals, they will manage. But sometimes the same skills to get at home is difficult because there are too many distractions. How do you set your home? How do you minimize the distractions? How do you get the child to engage with you? If you take care of these basics in which are given in these parent training programs, it will be easier for you and you'll not get so disheartened. Things that matter much. Constipation, constipation, constipation. Please treat. If somebody is giving you a laxative, do not get scared. Constipation affects sleep, affects appetite, affects a lot of things. The child is irritable, child is not engaging. Then we are giving him medication. So please ensure that your child is not constipated. 2 bowls per week, a lot of loose stools, but not, still the child is, as a parent that the child has not emptied his bowel. Many times there are sensory issues going on because of which the child is not happy to sit on the loo. And I think that this needs to be addressed. The diet, the nutrition, sleep hygiene, melatonin, we prescribe sometimes. It's a hormone that is in there in our bodies. So, there are things that are safe, and when in doubt, always do ask people, real people. Don't Google on Quora and all these websites, and get a lot of information which may or may not be valid for your child. Okay, get help for yourself. It's a very overwhelming diagnosis, not easy. It's not easy at all. And for every one person that tells you that yes, there is an issue, there will be 5 people who tell you kuch nahi hai, my son, that fellow, he. But remember what I showed you, you're losing time. If there are a bunch of professionals who are telling you that there are issues, trust them. They all want to work for your child's benefit. Nobody is gaining anything out of this except for the fact that we want to capitalize the early years and we want to help our children achieve whatever they can. And please understand and ask questions. Don't go home after a session and say, oh, okay, don't get scared. Everybody will help you. Nobody will think you are foolish or, itna bhi nahi samajh mein aata. It's nothing like that. These things are difficult. Even for us professionals to get trained and understand these nuances takes years of training and years of practice. So there's nothing to be ashamed of. Nobody is going to judge you. Please reach out to professionals who work with your child and ask them why. Why is this a different skill? What is it that you want from my child? And the more you ask, the more you'll understand. And it'll help you understand the rationale of therapy. And please take care of your health. Many times I've had parents who've had blood pressure changes and diabetes, and they're so caught up jumping from therapy to therapy and running from pillar to post that they are totally ignoring their health. Many parents get overwhelmed. There's a lot of anxiety that happens. WhatsApp groups don't help us at all because everybody is on a mission to post the best version of themselves in life. Trust me, it doesn't work that way. Everybody has problems. Everybody has problems. So please don't look at Facebook and Insta and WhatsApp groups. It's very difficult. If you follow these trends and then, underestimate what your child is able to achieve. It's not good for you. And please do complete the investigations that are recommended by medical professionals. They are important there for a reason, and they are validated by science. So please don't, read again Quora and all these things and say, oh no, but why to do the hearing? He's fine. Why to do the vision? He's fine. No, there are other things that we are looking at. And for us to rule out those things, we need to get the baseline investigations done. So please just complete what is asked of you. And please do learn the science and act early, because you have only to gain by doing that and nothing to lose. And thank you for your kind attention. I see some questions and answers. Do we want to address this now or after?
Yeah, so Doctor, let's take the Q&A at the end of the webinar. Yeah. Sure. Thank you so much for all the facts and the wonderful perspectives. And there's a lot for the parents to mull over. So
yes.
So let's begin with Dr. Anjali Joshi. Yeah, welcome,
Hi.
Doctor. Yeah.
Hi.
Welcome.
Yeah. You can see my screen, right?
Yes, yes, we can. Yeah.
Thank you, Dr. Rajeshwari, for such a wonderful introduction and setting up the map for me to take it forward. And good afternoon, all the parents. Thank you for being here on Sunday afternoon. And I'm going to use this time I'm hoping to give you some take-home message so that you can work with your children, as Dr. Rajeshwari said. So before I get into, the strategies or things that you can do at home, I'm an occupational therapist, and some of you must have heard this word also for the first time when the doctors told you that your child needs OT or the child needs speech therapy and so on. So I'll just quickly tell you where we and how do we work and which areas we address. So an occupational therapist is going to work on any developmental needs of the child. So it could be motor skills, social skills, communication, play, all those areas which when are in place, like Dr. Rajeshwari said, the milestones, we say the child is developing typically. But if there is a delay or in any of these areas, that is where an occupational therapist comes into the picture. We also work on educational needs, emotional behavioral needs, and of course, most importantly, the final goal for an occupational therapist is to work with the parents to make this child as independent as possible in the years to come. So that's a brief about who we are, and ensure that you're going to a trained occupational therapist when you start receiving services. They could be graduates, they could be postgraduates with specialized in pediatrics. Typically now, what are the concerns parents have when they come to us? So they've got to the doctor, they've received a diagnosis, or the doctors have just said that, we do see red flags, as we said, in social communication areas. So my child does not speak, or he's in his own world. He's very stubborn. He does not focus and is hyperactive. And most importantly, the parents rightly say that I need help to learn how to help in his development. And that's where I'm going to talk about today. And that's where an autist comes into the picture. So how can, when we say that working with children with social communication disorder or autism it's a path, it's a long process. And the therapist is going to start the intervention as soon as you see one. But of course, the therapist is also going to help you learn how you can work better with your child. And like Dr. Rajeshwari said, that it's something which is going to happen through the day. And you are going to see the therapist say once in a while, once in a week, twice a week, or thrice a week max. But beyond that, it's you who's going to be the child's therapist. So how can the parents and professionals work together? So what is it that you can gain and how you should gain and you should look for? One is, of course, seek help from a professional and do not chase the Google doctor. Please don't do that, because you have the therapist who are in contact with who will answer your questions. And if she can't answer certain questions, like say related to medical questions, she's going to refer you to the doctor. Do go to your doctor or do go to a professional therapist only. Very importantly, whether you start occupational therapy or you start speech therapy or whatever it is, continue interaction and communication through gestures, songs, picture books, and simple talks. First thing all of us have to remember is this is a child first, and then autism is coming later. Any kind of a disorder comes later. It's the child first. And what do children enjoy? What is the child's occupation, as we say in occupational therapy? It's play, and nothing else but play. If you want to initiate that play, start using gestures the way you learned as a child. So you learned with different action songs. You learned like Ita Ita Baisre Mora or Pitter Patter Raindrop. You learn through action. So use those gestures to communicate with child. Use lots of songs, picture books, and simple talks. Talk to your child, because only when you talk to the child's vocabulary is going to build up. If there is what we call it as the receptive language, and the expressive language will come and communication will come later. So do not stop that. That's the first message any therapist will give. Do start with therapies, 100%. Do talk to your professional therapist to say, what is my home program? But very importantly, your home program is going to be interaction and communication with your child, the way he enjoys it, the way you think he understands. So he doesn't understand words, that's fine. You can still use gestures. You can use your own facial expressions. You can be the toy for a child to make the child look at you and interact and have fun with you. The next part, and which is something which is again proven by science, like the impact program Dr. Rajeshwari was talking about. See, there is enough evidence and research to show two things which work with children is play, and the other is routine-based activities. Routine-based activities or daily activities are the best form of building the child's engagement, participation with you, focus and attention. All your concerns are that this child doesn't sit at one place, he doesn't look at me, he's running away all the time, he doesn't seem to be engaging with me. The best form of doing that is your routines and daily based activities. And what do I mean by routines and daily based activities? You can talk to your child by brushing his teeth. You can talk to the child while you're bathing the child. You can talk to the child while you're taking him to the therapy session and point to him the cars, point to him the cow, point to him the dogs. Talk about what you are doing routinely while he is in the kitchen, and you talk about how you're cooking, and here, oh, I spilled water. Oh my God, what are you doing? I can see you're playing with your teddy. Basic, simple communication. What happens is, many a times the risk here with when it comes to a child who has a communication delays, from the parent side there is less and less of talking because the child is not responding. See, finally we start to have a communication when somebody else is responding. If that response is not there, then we tend to get into saying, anyway, he doesn't respond, why should I talk? Right? It happens even in a normal circumstances. Now, this is where the parents also start reducing their communication or conversation with the child because the child doesn't seem to be responding. But he doesn't look at you does not mean he's not receiving the information that's coming in. Correct? And I'm sure you must have experienced that in your daily life, that he may not look at you, but the minute you say chocolate, he comes running. Correct? So don't worry, don't get disheartened that he's not looking, so I should not talk. Don't get into that mood. Definitely all sorts of routines and daily activities, and most importantly, engage in play and fun-based activities. Again, I'm repeating, he's a child first, autism comes later. So all those things we want or we love to do with children, you need to do with this child too, and the best way of getting the child to pay attention to you or to interact and engage with you is nothing else but play. Now, I have been saying so much about play and fun based. So let me just tell you what do I mean by that and what is that play all about. So what you're going to see here is a little child, a 7-month-old child, and there is some picture book reading that's going on. Unfortunately, you may not be able to hear it. Basically, the caregiver is talking about pointing to the baby pictures, hands, belly button, head, and the child is in her own ways trying to respond to that. So
His eyes. Yes, there are eyes. Oops. Where is baby's mouth? Yes, correct. That's where it is. Mouth. Where is baby's belly button? Belly button. Under her shirt it says, where are baby's feet? Feet. Huh? Where are baby's hands? Yes. Hands. Quick. Where is baby? No, no, no. Yo, baby, baby.
It's not going to take a lot of your time. It's just that when you have 5 minutes to 7 minutes of free time, and you're going to sit with the child to show pictures, and you can start that from the age you feel that there is some concern. You've not even seen probably a doctor. No harm in trying this kind of mode of communication. It's fun, it's engagement. The child is going to be with you, and your concerns about attention are going to be addressed. And then what you're going to see is just that bit of stimulation, and you're going to see that engagement, sitting down and looking at pictures. And as a therapist, I can tell you that a child sitting and looking at pictures is very, very important milestone, because then in future we are going to use that to build the child's language, to build the child's communication. We are going to talk about visuals and so on and so forth, but for which the child should start showing interest in pictures. So this is a very simple way of starting with play. If you're not so much into sit down play, or if your child is not too much into sit down play, here is something else you could try. One second. Here is something else which you could try.
2, 3, 4, 5, 6, 7.
देखो देखो क्या वो पेड़ है चादर ओढ़े या खड़ा कोई.
Jump. 1, 2, 3, 4, 5, 6, 7.
Hey, देखो देखो क्या वो पेड़ है चादर ओढ़े या खड़ा कोई. बारिश है या आसमान में छोड़ दिए हैं नल खुले
Rain slowly.
हम जैसे देखे ये जहां वैसा ही.
Friends, if as a therapist, if I have to analyze this video, you are going to, as parents, you're going to say, oh, this is a lot of fun, I would like to try it, but I don't know how useful this will be. And I'll tell you how and why it is a useful thing. As I said, in a therapy language, the child is paying attention to the song, copying actions, be present with another sibling or another child, indirectly, non-verbally interacting and engaging, and having fun. Now, the first message or the first concept that we learned as therapists is, when there is fun and active engagement, there is learning. When there is crying, there is no learning. And this is where the child, indirectly are working on the gross motor skills, the fine motor skills, listening, attention, all those milestones, so to say. Some of those words you must have heard from your therapist. Just having fun, play, dance, music are some of the things which you can practice at home, no matter what therapy you're receiving. Again, another very, very simple play where I'm going to talk about, where we say it's important because the child is attending, he's sitting down, he's copying actions. So something like this. As simple as this. Now, I also hear sometimes from parents that oh, well, I'm the only child and, there were no children in my house. So I really don't know how to play. And this is the first time a child has come into our house after so many years. And there is so many times there is that confusion as to what do you mean by play? How do I, what do I do with it? There are basic rules about play. How to play. One, very importantly, start with the child's likes. Make a list of things your child likes. Very common likes would be the child likes a balloon, the child likes a ball, the child likes to play in water, the child likes to play with rings, the child likes to play with a rattle. Make a list of those things. Start playing with those objects and activities. And one very important thing that you can do over here is have two of those. So if your child likes a ball, have another ball with you. If the child is rolling a ball, you start rolling the ball so that the child is made to look at you to say, what is she doing? And then you change from rolling to, say, tossing the ball, and you will see that the child will learn that motor imitation and will start doing it. Then you're going to, like Dr. Rajeshwari said, you're going to add the verbal imitation component. So start with motor imitation, ensure that the child is with you while you're doing it. Definitely add novelty to avoid instructional mode and repetition. Don't get into a teacher mode and do this, do that. Use a lot of praise, a lot of fun gestures and actions to tell the child, you too are having the best time on earth right now for 5 minutes when the child is playing with you. So tell the child that I too am enjoying it. It's important that you convey that through your body language, and do not get disheartened that it's not happening for more than 5 minutes. Not an issue at all. Even if it happens for 20 seconds, the child will slowly learn that this is fun and he'll keep coming to you for that fun. Provide choices and increase demands when you see boredom. So if you feel that the child is running away, ask yourself, could this be boredom? Can I change something? Can I make it more fun so the child comes back to me? Literally, believe me, you may have to start with few seconds initially, but 100% you will see that change, and you will see the child coming back to you for more and more such engagement, because they do realize this is fun. Children with autism do want to interact, they do want to play. It's not that they don't want to. Their methods are slightly different. We get into learning their modes and methods, and then slowly start teaching them that there are different other ways of interaction. That once happens, the child will keep coming to you. Initiate turn taking and be playful. It's very important that you teach two concepts to our children. One is that we teach them turn taking and we teach them waiting. So have simple rules in the game. That one, to clean up something, there is a closure of an activity, and then the next activity is start. The cleanup time is a time or is a concept where you tell the child you need to wait. Things are not going to happen magically. Saying that it's my turn again teaches the child waiting. And when you say my turn, there is a possibility that the child is going to look at you to say, okay, go ahead. Or the child is just going to wait and not do the action that he's doing. And that's something which is going to build up the child's attention and participation. Just simple things like that. Teach negotiations, waiting, encourage communication by being a role model. Talk to the child, use very simple language right now, use a lot of gestures, so the child will be able to catch, you will be able to catch the child's attention because of your gestures and because of your simple language. Again, I'm repeating, make the child feel that you are having the best of time and I love this interaction. Show it through your expressions, so the child too starts learning that engaging with another person and not being in my own world. I mean, engaging with another person is fun and being in my own world is not fun. Have fun with your child. Play, and the reason I'm saying have fun, because when it's a playful situation, learning is optimal. And again, there is enough literature and enough research to show active participation and engagement and fun will optimize learning in anybody. So if you want the child to learn certain skills or the certain milestones which are delayed, this is the best way to do it. I'm sharing with you some useful links which will talk about, where you'll get some of this information. So there are some links about one word or one terminology you might have heard, which is sensory, and which we are not really covering here at all. But there's a little video which will introduce what is sensory integration and what is sensory in children with autism. I'm also sharing one link here which talks about how do you initiate communication and how do you sustain communication and how do you talk to a child. So what do you mean by the way I said that, you talk about what you are doing, talk about what the child is doing to sustain that interaction. And the third one, of course, is a link where you'll get lots and lots of ideas about how do you build play in a child. So different basic play ideas. You can refer to these websites, and I know there are umpteen such websites available which will give you ideas about play. So with that, now, how to have fun? I've been repeating it again, fun, how to have fun. And what I learned in my professional, I'm sharing with you. One, drop your voice. You have to be playful, and your playfulness should be evident from your speech. You can't be directive, you can't be instructional, and that is not play. So see that you're not just asking questions to the child and directing him to say, sit down, come on, no, get up, say, tell me. All those things are more of questions, and the child is going to go into saying, oh, this is one teacher now, and I don't want to respond to this teacher. So drop your voice, drop your body. What do I mean by that? Go at the child's level. Our children often do not show interest in looking at the person. But if you sit down with the child is then forced to look at you and forced to copy your actions and imitations. And then he slowly starts to learn that it's fun to copy, fun to be with mom, fun to be with dad, fun to be with nanny, whoever that person is. So drop your body, drop the batteries. What do I mean by that? See, when you're choosing toys, and you can see some of these toys here, when you choose toys, avoid using battery operated toys. The reason is battery operated toys, the child doesn't need to do anything. He just switches on the button and the toy automatically starts working. So the child doesn't really understand the basic concept of cause and effect, that I do something and something happens. In all these toys that I have showed pictures of, the child has to do something. You can demonstrate to the child what needs to be done. So you fix the link and say, oh, wow, red and green. And the child then learns that, okay, I can fix a ring, or I can pull the link. I can fix a shape. I can copy what mom is doing. So avoid using battery operated toys. Drop your guard. Don't feel that, how can I be so silly? It looks so stupid. I have to take him for therapies. Why should I do all these things? So get that fear out, that fun is frivolous and I shouldn't spend time over it. When those 5 minutes, or forget 5 minutes, even if 3 minutes when you spend with the child, ensure that you're totally with your child at that point of time. Your phone is off, your TV is off, and just the 2-3 minutes of that interaction, slowly you will start seeing that 3 minutes of interaction over 5 and 6 minutes by different people means you're therapeutically engaging with your child for so many hours. And all that is without having that stress or fear or the tension of doing therapy with your child at home. You don't have to do therapy with your child at home. You just have to have fun. You just have to have play. You just have to engage the child in routines and daily activities. Therapists will do the job of doing therapies with your child. Now, the last bit of it, when I talk to parents, I often hear that somewhere they feel that if I don't talk to the child will get motivated and will start talking to me. So I'm not going to talk to him. Let him realize the need to talk. It doesn't happen like that in autism. If you don't talk, in fact, he will not see the power of talking or power of communication. So it's very important that don't get into the mode of saying, I will not talk, and therefore, if I don't talk, he will talk to me. He will not. So do talk to the child. You don't have to use big words. You don't have to use long sentences. Use simple words, simple sentences, and use gestures along with that, because we learn first the gestures and then we start to speak. So your child may not be able to use a word, but at least he will be able to do a gesture and say, I want water, or he will be able to use a gesture to say tata, meaning I want to go out. Another myth is playing with the child takes away the therapy time. No, you playing with your child complements the therapy. So do not get that fear, or do not get stress and say, oh God, if I'm playing, then how will I do the therapy homework, so to say. Therapy homework is nothing but engaging the child in routines, engaging the child in self-care activities, encouraging him to participate in those activities and in play. Another third myth, which I often feel parents have got into, is it's better to spend time over practicing activities done during therapies than teaching the child self-care activities and daily chores. You don't have to practice activities which the therapist does in therapy room. The activities that you're going to do, the play that you're going to engage in, the fun activities, the daily activities, literally including teaching the child to bathe, to dress, to undress, to wear shoes, to tie shoelaces, to filling up the water bottles, to getting a plate out for himself, to putting away the plate in the sink. All these activities, if I have to sit down to analyze, all these activities have all the therapeutic components that I have in mind when I teach a particular activity or I use a particular activity during my therapy session. So don't get stressed by saying, now I have to learn how to how to make this child bounce on the therapy ball, or I have to learn to teach this child do a particular kind of a puzzle which the therapist does with him. No, it's really not required. Using your routine-based activities is something which is going to be very, very meaningful. So I hope I have been able to give you some strategies that you can use with your child. And here are some very, very simple toys that you can use with your child. Little toddlers, the best toy many a times is soap bubbles, because, you know, it's fun, it's quick, it's short, and the child loves those bubbles. When you bring the soap bubble in front of your eyes, the child is tempted to look at your face because the bubble is right there. He's going to learn to imitate your action of blowing the bubble. So you're getting all those oral musculatures, as we use in our therapy word, activated. Body parts, a game like a potato head, small little pom-poms or small little colorful balls or cotton balls, and picking them up. You can work on teaching different pre-academic concepts to having this child engage in that particular toy. Other basic simple toys like your rings, and the games like plot 4, which are which are going to teach turn taking. I'm not specifically promoting any of these toys. I'm just picking up these examples because, you know, these are the ways, these are different ways in which you can engage with a child without spending a lot of money, yet provide, complement the therapies which your child is receiving. So yes, with that, I have come to an end of my presentation, and I'm happy to answer any questions if anyone here has.
Thank you so much, Dr. Anjali. That was really informative. And I think both of you have really focused on a very important facet, which is play. And that is how, the early intervention happens. And most often parents do forget that they are not expected to be therapists and to use a lot of non-directive language rather than a lot of questions, So yeah, so there are a lot of questions And one of the questions which, when we had given the survey to parents, was how do I handle the repetitive behavior patterns in my child? So could you briefly answer that first?
Dr. Rajeshwari, would you like to start first and then I'll add?
Yeah, sure. So repetitive behaviors, sometimes it's very, I think every behavior has a and a B and a C. So, there is always a reason for a behavior. It never happens without any specific reason. If a child is repetitive, say repetitively talking or repetitively playing, it indicates that the child doesn't know how to expand that repertoire of play, or doesn't know how to better use that toy, and doesn't know how to ask for help to do that. So now at the same time, that toy is giving the child a lot of comfort. Okay, because there's a lot of stuff that the child does with the toy. So the practical thing, it's easiest to take away the toy, or to hide the toy, or to, say that this is what is causing autism. The fact that the child is spinning the wheels or playing with the toy is what is causing autism. But it's important for us to understand that it is just dysregulated play. The child doesn't have any other method of playing or imitating. And if you take away the one thing that the child plays with or has comfort from, what do you expect the child to do? So like Dr. Anjali mentioned, their children first. And children do have their rights. One of them is they do need to have rights to what they can play with. It is our job as facilitators and trainers to help them expand their repertoire of play. Another reason for repetitive behaviors also is anxiety. When a child is anxious, when a child is put in a situation where the child senses that this is way out of my control. So for example, a wedding function or a party or a birthday party or something, and children have this intuition, they know that they're not able to fit in. And it's when they have that intuition and they get very anxious, all their repetitive behaviors will go up. And it then causes a lot of anxiety in us as caregivers, because we feel, oh god, autism is coming up, autism is coming up. So it is important for us to analyze why is this repetitive behavior happening? Is it because of anxiety? Is it because of dysregulated play? Is it there is a sensory need for the child to calm himself down, because of which this child seeks this particular activity? And once we are able to analyze that, I think we will be able to handle this better.
Yeah, I think like you said about the anxiety, I think it's very important that the parents, typically what they'll say is, no, you're not going to get this, which indirectly also is going to increase my anxiety. So, I like to play with a top, and here is mom who's saying, no, enough, don't spin. No, take it away. If you use another strategy, the first thing, of course, is you're going to say, what are the different other interests that I can build in this child, so that he's not only interested in the top. He could be interested in ball, he could be interested in playing with a car. So you're building his repertoire of likes, as we say. That's one. Two, when the child is engaging in that particular toy in a so-called inappropriate way, if you put in that limit to say 3 more counts and this is going to go away, one, the child knows that it's not that as soon as I grab it, it is going to go away. Because if it's going to go away the minute I look at it also, it's going to in fact increase my anxiety. That means I'm never going to get it. Oh God, this is gone out of my life. Because if I'm not getting it now, for a child with autism to understand that I will get it maybe later is impossible. For him, it's gone means it's gone. And that itself will be an anxiety provoking situation. So whereas if you say, oh, you want to play with the top, 3 more counts and top is gone. The top stays right next to the child while the child is doing something else, and the mom gives him the top before the child asks for it, which also the child slowly starts realizing that I don't have to grab it, because I will get it. Yes, I will get it for a brief period of time, but I am going to get it. Will also reduce the need for that craving, so to say, for that particular behavior or particular object.
Right.
Yeah.
So building that trust and connection is also so important. And looking at any behavior as what function, it has, rather than looking at as behavior. So let's go to the other questions. Dr. Rajeshwari, would you like to address a question first?
Yeah, I think there were some questions about in the chat also about whether autism is really increasing or are we able to pick it up better?
Yeah.
Again, there are a lot of factors that are being researched. There is definitely a rise. There's no doubting that. But what are the factors? So, for example, is it, there are more premature births? Is it advanced? We have, multiple factors that are being researched into. So I think a parent has also put in a question about, shouldn't more research be done in these areas? Yes, there is research happening. Even in India, we are actually researching the genetic profile of all the children who have had these communication delays and seeing if there are patterns, there are genes. So there are shank genes. There are some genes that are getting replicated. And these genes, when they change, they are, they mutate. So you understand the word mutation. If a gene is supposed to look like this, it will look like this. This is mutation. It changes. So is that causing these disordered patterns of learning? So screen is also being looked into very actively. But as of now, we're not getting any robust evidence. What I mean by robust evidence for environmental factors is we have assessed around 20-30,000 children where all the other factors are the same. The parent, the therapies, the parents spending time, they have the same socioeconomic background, they have the same everything is the same. Their ages are the same. The ages when they were born are the same. All the children are full term. So there are a lot of, we call this in medical language, confounding variables. So there are a lot of variables which need to be ruled out. And it is so tough to do that in something like this. So that is the reason why research is taking time. It's not that it is not happening. It is happening and very, very intensively happening because everybody is concerned. Everybody wants to, help. And therefore, research is happening. But unfortunately, what happens in these research articles is if you look at a particular article and this article is not from official sources like PubMed or other scientific journals, wherein there are a lot of screens happening. So if I were to publish an article in any medical journal, if I don't meet data for a research article, my article will be rejected. So you have to, as professionals and caregivers, we all have to choose the correct articles to substantiate that yes, work is happening. There are some very good international websites. I shared some with you. And the center that was mentioned, a parent asked me that, is the Center of Developing Brain. Let me just pull up that website. Center of Developing Brain. It is run by Harvard. It is actually done by Harvard. It's a fantastic website. It talks to us about serve and return. So they say that this is like a volley of tennis. You have to serve and return. So many times we serve, return is a little challenging. So that is why it's important for us to actually sit down and ensure that the child returns the volley. And this builds the architecture in the brain. Center on the Developing Child by Harvard University. That is the website. And these videos that I have used is all from the CDC, Atlanta, and they are freely available. It is there in module 1. I don't think that there are any copy. It is freely available. If you want to go back and look at more videos, there are many videos. Because of the time constraints, I could not obviously share all of them, but I do have a video on the echolalia. If it's okay to share that for 2 minutes, I can. So it's easy for us to see, where is this thing?
Yeah, it'll be nice because all the videos that you all showed, it helps the parents to get a clearer picture.
Yeah. Is the video showing?
No, it's not yet open. Yeah.
So is it showing now?
Yes. You need to maximize it.
Okay, yeah.
Yes.
So the
Hi,
echoing.
Lucas. Penelope, hi, Georgia. Hi, give me a hug. Let me tell you something. Give me a big hug. Oh, how are you? I'm fine. I'm fine. Good. Are you playing? Cheek, 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 cheek. Oh, it's cold. Look.
So it's so clear in this video, as all the things that I was telling, the child is repeating, the child is echoing, but see the body language. When someone's greeting him, he turns away. The repetition is happening. There is language, but it's not reciprocal. It's not like, okay, I see you and you're telling me hi. And so that, the person has to go to his level, turn him face to face, make him understand that, look, I'm like kind of greeting you. And then when she says, how are you? He repeats that. That's language, but that's not communication, because he's supposed to say, I'm fine. So when she prompts him for that, he says, I'm fine. So this is what we mean by echoing. Echoing, just saying the words and saying the language, is not communication. The same words, when used with non-verbal cues, like you're facing the person, you're looking at the person, you're trying to convey in any which manner that you've understood the person, that is true communication. Yeah. So
I think another website of Dr. Rajeshwari will agree will be Autism Speaks for Parents.
yes.
So that's again a website which will give you evidence-based
Yes.
strategies. And I think rather than going into looking at any website, that would be a good one.
Yes, I agree. Autism Speaks is there are some funny things about how to stop Autism Speaks. So, the internet is a crazy place, I think.
It is.
It is. And, there's enough and more people who want to just confuse everything. And in that process, take away the time from us and actually wanting to help our children. So I think there are these demons out there who just don't understand what they are posting. It is very, very important, because it's not their loss. They have nothing to lose. The loss is ours and the gains are ours. So we must reach out to people who know, and whom we know intuitively that this person is genuine, right? We can reach out to them, we can ask them, and don't be ashamed, don't be scared. Genuinely, people who want to genuinely help us are always forthcoming. They will always help you, and they will always try and make you understand why they are concerned. So don't hesitate.
Yeah, and I think that probably there's one question about some parents saying that my therapist is not sharing a sensory diet. And I think my request to that, my suggestion to that parent is go back and say that I want just 2 things that I can do with my child at home. So if you keep pushing for that and saying, give me 2 activities or 2 things that I can do with my child at home, your therapist is going to give you at least that much, if not an entire list of things. Sensory diet is something which is, it's a whole, a separate topic per se. But I think what I can suggest to answer that particular parent is, if not anything, at least start with some movement-based activity with your child. So let's not complicate into what different other activities, but ensure that your child goes to the playground or goes to a park at least two to three times in a week. I'm saying 2 to 3 times because distance can be a problem. You don't have an access to a park, but ensure that is there. Secondly, ensure that there is some sort of basic aerobic form of activity that you're doing with a child. So we're not talking about big yoga poses for little toddlers, but simple things like animal walks or soldier walks. Start with those, but put that into the child's routine, where the child realizes that this is something which I do every day. I also often suggest to the parents that you also get into that mode of doing some exercises with your child in the morning. So the child sees that this is the pattern in my house, and he copies what the parents are doing, because that is another very, very simple sensory diet that I can recommend to anybody. Other than that, yes, of course, having a swing at home or something like that, but those things are not practically possible in each and every house, especially in Bombay. But yes, taking a child to a park is something which is not impossible at least 2 or 3 times in a week. But my suggestion to this particular parent is go back to your therapist and say, give me 2 things which I can do with my child based on your observation of what my child likes to do the most in the therapy setup. And I'm sure you'll get the answer for that.
Dr. Anjali, many times I've heard parents saying that my therapist plays the same things with my child. What message do you have for these parents?
Uh, I think the whole issue of my therapist is doing the same thing probably is coming out of lack of communication between the therapist and the parents. Therapist not explaining why I'm doing the same thing, what is the rationale behind it, and parents sometimes hesitating to ask with a fear that, am I going to spoil my relationship if I ask question? And that's where I think what, as you know, I have been promoting all the time, that the parents must remember and the therapist must remember that it's equal partnership. It's not that the therapist is here and the parent is down there. And only when you start asking questions and trying to get answers from the therapist, you'll know why it is the same thing that's going on. Because say, for example, if a therapist is using the swing day in and day out every session, she's looking at different, what we call it as a different kinds of adaptive responses. So the adaptive response, I'm using a little bit technical jargon here, but the adaptive response the therapist might be looking at is this child giving me an eye contact with that kind of a vestibular input? Is this child verbalizing because of that vestibular and a proprioceptive input? Is this child focusing and participating in some fine motor activity with that kind of an input? Now, these are some of the responses that I'm looking at. And I will build up an assumption or hypothesis that these inputs, the inputs that I'm using daily, I mean daily meaning every session, are giving me different sets of adaptive responses. So I'm going to continue using that. I do understand that the parents are going to find it a little confusing because they do not know the science behind it. I strongly propose and I strongly recommend and suggest to the parents that go back and ask that what is the science behind what you are doing. And once you know that, then it will not look like, oh, every time he goes on into the therapy room and he does X, Y, Z, and we come back home. And I appreciate you asking this question, because I think this is where I fear many a times that the parents keep saying that I do OT at home. You can't do OT at home. You can do something which will complement OT. OT will be done by OTist, and you don't have to become an occupational therapist. You can be your child's parent, but do something which will complement your therapies.
Yeah, I think you all have very beautifully brought out the difference between play and therapy.
Yeah.
So
also, I wanted to also add from my slide, I mentioned that it needs to be repetitive, predictable, because there is a disorder. So many times, and the only way we can do this with children is through play. We cannot talk to them and play, treat them like adults. They are not in that same wavelength. So many times there are activities which look repetitive and predictable and the same thing is happening, but you have to understand what is the rationale behind that. So if you practice that in other ways at home, then you're addressing the core skill, and then the therapist can also move on, right? So sometimes it's very difficult for professionals also to kind of so at the end of the day, I think there needs to be more openness. Many therapists, when I reach out and tell them that allow the parents in, so many therapists are like, but ma'am, what happens, then the child clings to the parent, the child cries, and then parents feel paisa waste ho gaya, and then they search for another therapist. So you see, there are always two sides to a coin. It's never that somebody doesn't want to do something. And so we need to be more open, and that is why it is important for us to understand what is being worked on. There are two questions, Anjali, that I think we need to address. There are very specific questions about the way the child is playing. So there's one parent who's asked, the child holds a spoon, and the other parent has asked, the child whistles, and this is repetitive behavior. A, why is this behavior happening? Is the only way the child can play or the child has comfort? B, that's the behavior. C, how are you handling that behavior as a parent?
Absolutely.
Okay.
Correct.
Are you getting anxious? Oh my God, this is autism-like behavior. Then you've lost the plot. But what if you can do something as simple as, imitate the child, whistle along with him, and then change the pattern of your whistling and see if the child responds to you and looks at you and understands that, oh, you've changed the whistle. If the child is playing with the spoon, like lemon and spoon, of course, the child shouldn't be swallowing it, but something big, as in make the play more creative rather than thinking that this is autism and this is repetitive behavior. Because, the more we start thinking like that, the more we take away the opportunities that we have at home to build these routines. I mean, I'm sure Anjali will add on her expert advice on this, but it's
Yeah, I think there are two things here, which I mean, one most important thing, what point you said is, okay, built up on that, let the child, if the child is playing something, you start interacting with him. The second bit is, of course, the minute you say, don't do that, put it down, you've given a child a response. What this child is looking at is, when will mama and daddy talk to me? When will they talk in a most animated way with me? They will talk in a most animated way when I take the spoon in my hand, because they come running and say, hey, shh, put it down. I'm sure the parent is not doing something like this. I'm just using the story here as an example. But what does the child learn? That when I want my parents to talk to me, oh, it's very simple. I just have to get the spoon and keep doing this. And they come running to stop me from doing that. That is one. Secondly, I think we, especially with young children, and because this is a webinar primarily for little kids, we also have to remember that certain things are milestone appropriate also. So what happens is, minute there is a diagnosis, we start looking at everything through a microscope, and we label and we try and put everything under autism. And I'll give you an example of a mother who had, I remember she had, the child was just 2.5, and her concern was, oh, he never stands at the bus stop when the bus, we are waiting for a bus. So my question to her was that, which 2.5-year will stand straight at the bus stop and say, oh, mom, 64 hasn't come. Looks like 71 bus already went. Nobody is going to do that. No child at 2.5 is going to do that. That has nothing to do with autism. That is how kids' attention is at that time. So we don't have to get stressed about every action and say that this is related to autism. At the same time, what is the consequence? What is the reward that the child is getting, or what's the response rather the child is getting, will determine whether the child is going to copy or repeat that action again and again. So my suggestion to that parent is, if it's spoon, can you start with that and say, okay, let's play ting ting ting. Then going on to say, oh, where's the spoon, and hide it and let the child look for that spoon. Bring a bigger spoon and say, oh, I have a bigger spoon. Do you want this? And give the bigger spoon. So start with interaction, attention, engagement. Slowly the child will get disinterested in the spoon, not because, one, because he's getting it many times. And second, he starts realizing that instead of playing with a spoon, actually talking to mom and, doing all that funny musty with mom is more interesting. Yeah.
Right.
There's another question about non-verbal. Till what age?
Yeah.
This is a tough one. I mean, because again, verbal and non-verbal, there are multiple factors that first need to be looked into. Um, it's kind of difficult to answer this, with scientifically, just because we've not assessed, and we don't know. But yes, I've had children who have started communicating at 7.5. I have had those children. So that's what this working for so many years has taught me, that we underestimate and we make conclusions too soon, and much of what we base is based on what the others are talking, and we are not analyzing what we are, what are our child's unique strengths and how we can capture those. So we just need to shift our focus, I feel, and not give up hope. is one. Now, there is also an AAC based question. Yeah. So I think either one, but you need to do it with a professional. See, any modality or any intervention always has a science behind it, and you need to do it with a professional. It's okay to download, it's okay to do online training, but there needs to be some hands-on training in this too. And the third thing I would like to share is my personal experience. I attended a wedding in last year, wherein it was a family wedding, and the girl's cousin brother had, he was in the spectrum. He was 24 years old. I didn't see him use a lot of words, but we have a lot of rituals which happen in early morning, 4 a.m. There's huge Chennai blazing and all of that. This man was absolutely in sync with everything. He participated in everything. He was absolutely well dressed. He sat with us. He ate with us. He went up on the mandap and he did all the rituals that were expected of him. And me being me, I went up and asked the parents, like, I mean, amazing. And so they were like, they were not upset that I raised the point. And they were like, no, we've just trained him. We've just trained him to do his daily activities, because that's what was causing him a lot of anxiety. And so we realized that, that's where he needs to be trained in. And when I came back and asked my family members, like, what do you think? So they were like, oh, he's cute. Na? He's participating in everything. Acha, uska sari ka color kitna acha tha, uska jewelry. So I realized that, we sometimes magnify these perceptions of what people will think about our child and what people will think about our boy and girl, and what will the world think about us. And it was an eye-opener for me when my family members were like, oh, he's so nice, he participated in everything, and absolutely no problem. And we observed that when the Chennai got too loud, he went up and sat in the hall, which was such a smart thing to do, because even we do get upset with these Chennai sounds. We should have also done that. So I felt, looking at that many times we must not gauge our children's progress based on what we perceive the world is thinking about us, but with objective gains. So for this non-verbal bit, this man was non-verbal, but he was absolutely good in everything. A. B, we need to do an assessment and see if there's anything that can, help in your goal as a family to make him verbal, which is an understandable goal, and it is an important goal for us because it is your goal. And third is any program that you use, you must use it with a professional. Anjali,
Correct.
if you want to add
Yeah,
on.
no, correct. I think no, you've covered everything, and I want to tell the parents that a non-verbal child is not going to become verbal magically. So there is going to be that work, like, you're going to use visuals, you're going to use ASC, you're going to use other modalities to keep him interested in communicating. So the fear which parents have that, I don't want to use visuals and I don't want to use other modalities because, well, then he will never speak, is not true. So don't get scared that if I use this, to baat hi nahi karega. And many a times parents say, he's talking, so why should I use visuals, or why should I go to a speech therapist for any other communication devices or something like that? No, it's not that. In fact, you will facilitate more verbal communication if you use these modalities. Definitely, you need help from the professionals to use them, but don't hesitate. These are the modalities which will be one step towards verbal communication for a child.
True. And adding to it, like, social communication is so complex that even children who are verbal will also, it will help them to use visual structures, right? And using visuals even for complex communication. So, which
Absolutely.
is something which is required across the spectrum. Okay, so which are the harmful alternatives parents should avoid? Like, we've already talked about evidence-based. So
Yeah. I think I'll share my experiences again. So, generally parents are open because with me, and I facilitate that because I want to know what's happening in the background. It's important for me so that I can help families understand which are the dangerous things. Now, stem cell, for example, the science behind it is okay, right? The science behind this concept that, you are building certain orders in the architecture of the brain by injecting stem cells, the science is okay. But is it happening in practice? Unfortunately, we have still not got any evidence for the same. Okay, and so when there is no evidence, it is important for us to really understand if we want to put, our child through a program or something that has no evidence. Plus, many times when parents do stem cell therapy and they come back to me and they do tell me that no, he's regulating better, he's paying attention better. But then, I'm like, okay, let him communicate to me what he wants, and that's not happening. So for me, it's always about how the child is responding to what I ask and how the child is communicating. That is important for me. And if I don't see that in practice, then and I see that with educational interventions. So I'm not propagating educational interventions over. I'm telling you is that there's no evidence for stem cell, and it is an invasive procedure. Same goes for hyperbaric oxygen therapy. It is an invasive procedure. We've not even tested hearing in our child, and we expose our children to high volumes of oxygen. There can be barotrauma. Our middle ear can, the drum can rupture, susceptible to infection. So, there are a lot of things that are important. Now, goat's milk is deficient in folate. Now, the child will, if folate and B12 deficiency happens, there's going to be leg pain. The child is not going to be able to participate in therapy. So, before starting, okay, we feel that milk, many parents have anecdotally told me, but ma'am, I'm convinced that milk makes him hyperactive. Sugar makes him hyperactive. So, what's the science behind the sugar making the child hyperactive? What happens is the pure, sheer scientific logic. You eat processed sugars, there's a spike in your sugar levels, insulin is released, and this insulin is going to neutralize your sugar, and there's going to be a deep spike up and down. When you eat sustained sources of food like proteins or carbohydrates, for example, the spike is not like that. It's more, and this is what we use for diabetics too, when we advise diet for diabetics. So it's not sugar that is causing the child to be hyperactive. Sugar is causing release of insulin. Insulin is neutralizing the sugar very quickly. So the body is again sugar deficient, energy deficient, which causes adrenaline to get secreted. Adrenaline is called the fright and flight hormone. It is always released when we are hungry, when we perceive danger. It's the flight and fright hormone. So in all these things from Cora and all these theories, we really need to scientifically validate. And parents feel so guilty if the child has a spoon of shira, in a function, and the grandparents feel so offended that prasad hota and nahi khalla, and there's so much of fighting and so much of guilt. So no, I mean, be rational, be logical. It's very important that, and I'm sure so many of us are reputed professionals in our field. We have reached where we are using logic, hard work, and basic intelligence. All we want is for all of us to tap into those resources and use the same for our children. So
Yeah.
don't do anything that's harmful.
Yeah, I think we also need to add camel milk into that, which is so expensive and parents get into it, and any other diets too. See, I think with the diets also, I'm not even labeling or naming any diet, but the thing is, if your family is not going to follow it, it's your only poor child who's supposed to do that, and you are in fact triggering all the challenging behaviors there, because the child can see that the elder brother or the father or the grandfather can have what I want to have, and it's only me who's not going to, and the child's behaviors are going to increase just by that particular one action of yours. So think whether it's something which you're doing is practically possible. Is it something which is universally at home across the family members applied? And then of course whether there is evidence. So like including, when I say teach a daily chore to a child, a functional chore to the child, and ensure that the child keeps his shoes back or his bag back, nobody in the house is doing that, and here is a poor child who's supposed to only one person is supposed to do that. It's not going to happen. So it's the same thing with any of these diet related interventions and other things too. Camel for sure, because I know this, I mean, people have been paying through their noses to get that camel milk. And so do talk to your doctors when you hear these things and verify before getting into any of those modes.
And same
Yeah.
goes for chips and other processed foods. It's not healthy for the whole family. So, you have to set systems in place and not label everything as increasing the autistic behaviors. This
Right.
cause and effect must not happen. It's something that we must think logically, whether it is helping our child or not, and focus on building interactions and routines at home. Once your brain is engaged in that, it doesn't have any space to look into all this. This is what I have seen in parents who have done this.
Yeah.
Absolutely.
Also, a red flag is someone says the word treatment, So I think that should be like a
No.
major thing. Okay? Someone says treatment, which means it's
Yeah.
not something which we should go for.
It is rehabilitation. It is, I think, in many ways helping. I will not use neurotypicals, and I don't believe in. It's just a different way of being. It's just a different way of being. So sometimes I tell parents, what if our child was in planet Mars and this behavior was okay there, and we all were the abnormal ones, so called, and it's just about getting them to engage with us, in which we can understand, and us understanding how we can engage with them better.
True.
Okay.
Yeah. So also a parent asked this question, how to teach age appropriate behaviors. Now, here is also a message, because like when it comes to our children, the milestones are different, right? We don't. So could you all please help the parent with this question?
Okay. I think, do you want to begin or should I start, Rajeshwari? I'm not sure what is, first of all, what the parent means by age appropriate behaviors. I'm assuming that the person is talking about age appropriate functions and skills more than the behavior, and any behavior as socially appropriate behavior.
Yeah.
So not screaming at the top of his head when you are somewhere, or not sitting in anybody's and everybody's lap, going and touching someone inappropriately, all those things. And most importantly, age appropriate skills. I think the first thing in this is, you need to start now, or you need to start yesterday, because nothing is going to come magically in a child if you have not invested from day one. And again, that has nothing to do with autism. It's for any child. You can't expect a 7-year-old suddenly to learn that he can't come without clothes from the bathroom if you have not put in that practice of appropriately coming out, wrapping a towel around his waist while coming out of the bathroom. So it's the same thing. Only difference is, for a neurotypical child, maybe you say it once and twice and the child will get it. Our children will take maybe 4 or 5 repetitions of that. But any behavior which is, if anything which is age appropriate, when we say, you need to start with that level, or start with that teaching that particular skill from day one. The minute you know that this child is delayed in that skill, one. To start at the child's level. So what is the child capable of doing? Start from there. Don't keep a large goal there. Every small step, you reinforce that with praise, to say, oh, I like the way you did this. And then add support. Because one of the risks with our children, I see with parents, is that they make the child completely physical prompt dependent and verbal prompt dependent. We don't wait to see whether this child is capable of doing. And then if we don't wait, the child never does it independently. Like in Marathi, we say sang kamya. So, only when I'm told, I will do it. And that's something which if you don't, you start reducing your prompts, the child will be able to learn an age appropriate behavior or a skill as he progresses.
Also, I wanted to add, because yesterday only I had a session with a parent, and like there's no progress happening because there's no words. So yes, it was very disheartening. So we said, okay, let's analyze, let's go back, let's see what the child is doing. And then we discovered that the child is not yet pointing to get what he wants, still pulling hand. So now the risk in this age appropriate milestones follows hierarchy. There is a pattern. You need to achieve the previous milestone. So you need to sit before you stand and walk. You need to point and use gestures before you talk. You need to do simple play, exploring play before you learn to do pretend play and then role play. And so there is a hierarchy. So just because your child is 4 years old and you feel that oh, he has to learn to talk in 4-word sentences, but the child is just using a single word, he has to cross that benchmark of 2 words, 3-word sentences, and then 4-word sentences. So age appropriate, I feel, is sometimes it's like a bottomless pit, and you, in setting that goal for yourself, you then are lost. So it is rather important to see what your child was 6 months ago. Where is he now? Where is she now in these areas, in imitation, in communication, in attention, in regulation? So these are the ways that we can actually objectively target and increase the speed of those milestones that are being achieved. But if we are going to expect the child to do something that is difficult for them just because it is age appropriate, you're not going to achieve much success. And then, it's very disheartening when that happens.
Yeah, it's like the child is in 4th grade and then tomorrow we want to pass his SSC exam.
Yeah, something
It's
like
not
that.
going to happen. Yeah,
Correct.
it's not going to
Yeah,
happen.
yeah.
Yeah.
And so these milestone checks can sometimes be, not very productive. It always makes sense to go back to what your child was doing and then objectively write down, okay, he wasn't pointing, he is now. Okay, he wasn't imitating, he is now. Okay, he wasn't, sitting and engaging with the therapist or with me. Now he's doing it for 15 minutes. So be very objective and that's why go back and ask your professionals, what is it that you're expecting my child to do in the next 6 months? That's a very good way of opening a conversation, I feel.
Yeah.
So which is easy for the therapist professionals also to understand. And they're like, oh, wow, this is so nice. Like, we are working together. They just get this feeling that, oh, great. The parents also are like reaching out to us. And what do we expect in the next 6 months? And how can we be a part of this? I feel that is a very nice way of setting goals for yourself rather than looking at age milestones and setting goals based on that.
Absolutely. And without comparing, because like each of our children are so unique, right, with their own strengths and skill sets. So very often when we as parents discuss amongst each other, every parent is talking with respect to her or his experience. But always a therapist is so closely working with your child, is the best person to objectively help. Also, Dr. Rajeshwari, a parent wants to know how to get your appointment. So uh, the
So,
clinic, could you mention the names of the clinics or?
yeah, so I'm at, so I shall share those details later and you
In
can
the,
pass it
yeah,
on. Yeah, you can pass it on
yeah.
to the family
So
because
Priyanka, you can get
and
to Priyanka. Priyanka will,
yeah, there's
pass
some
on the.
issues with endorsements and stuff like that. So, so
Okay, yeah. So Priyanka will message the contact details for both the
yeah, I think that's
speakers.
a
Yeah.
good one. Yeah.
Okay.
So I think
Yeah.
the take home message, at least which I want to share, is never give up hope. Don't compare. It's not comparing and contrasting. Every individual is unique. I may have some strengths as an individual, and I've stopped comparing long back because it only gives me negativity. So it is very important to understand what are your unique strengths and what are your child's unique strengths. Please reach out to professionals who want to help you understand the reasons why they want to do something, they don't want to do something. Most professionals that I have interacted with are genuine, they really genuinely want to help, and it's not an easy field to be in. I'm sure Anjali will agree with me. It's so tough at the end of the day. Sometimes it's so exhausting. And sometimes some children are, they do so well and the whole day is done for us, so we want all our children to progress there, but it can only happen when we have faith, we have hope, and we work consistently, we work predictably, we don't do doctor shopping, we don't do therapy professionals shopping, we open out to people with whom we have trusted our children, and we tell them what we expect from them. And if they are not able to give you answers for that, then maybe then you can take your options. Read trusted websites, do not fall prey to and if you're not sure about what is trusted or not, your pediatricians are always there. Many of them, we are having a lot of webinars and updates, and I've had this talk with pediatricians about what are the evidence-based practices for children who are having communication difficulties. I've had this talk, and many of us are talking. So many pediatricians do know. So if it's difficult to get hold of your DP or your therapist, professional, or your neurologist, you can always reach out to your pediatrician. But do not start anything without confirming whether this is. So many pediatricians are on a, like a WhatsApp message basis with me and many of the DP. So they'll just kind of, quickly text us and say, look, this so-and-so parent wants to start this. What do we tell them if they are not sure, right? Or they will put, I've had con calls many times with parents and pediatricians, and we've had all of these discussions. So you only have to ask. You don't have to get scared of asking.
Yeah, I think just two things that I wanted to add, and Dr. Rajeshwari has summed it up so well. Very importantly, pat on your back and rejoice every little success that you see in your child. So every one new step that your child is doing, be very proud of it, be very happy about it, and do not compare yourself with another mother. All the mothers want to do the best for their child. Some mothers may stay awake till 12 o'clock, and some mothers may get up at 4 o'clock to do something for their child. So don't compare yourself and feel guilty that, oh my God, she's doing so much, here I am, I can't do it. It's never like that. And definitely enjoy every little one step or the milestone your child is achieving, because that will give you that energy. Seek help from other people. Don't hesitate to ask your family members to pool in their efforts or take some responsibility, and take that respite time for yourself to go out for a movie or chill for one day. You need that energy. Okay.
Thank you so much, both of our guest speakers. I think we've learned a lot of facts and a lot of good practices today. And it is definitely going to help all the newly diagnosed, parents, I would say. So thank you so much, and hoping to have you all back for other related topics, because I'm sure parents are waiting for more such things, and they still have a lot of questions which all can't be answered in this. So thank you, and
Thank you.
let's end this session today.
Thank you so much.
Thank you.
Thank you. Bye-bye. Thank you.
everyone.